It's my privilege to, on behalf of Health Sciences North, to talk a little bit about Health Sciences North senior strategy. Health Sciences North, like many hospitals in the province of Ontario, is pursuing to be a senior-friendly hospital. We're using as our framework to improve the Senior-Friendly Hospital Initiative that was developed by the Ontario Regional Geriatric Programs and adopted by Ontario Northeast, our Ontario LHINs, as the strategy around which hospitals can use to evaluate the programs and services they provide, and has the criteria against which they can evaluate the degree to which their programs are senior-friendly. Of course, the aims of the Senior-Friendly Hospital Initiative are quite simple, and that is to improve the health of seniors by addressing issues related to their function, so that when seniors come to the hospital, we're not seeing decline in function, but their function is being maintained and in fact maybe even improved. And of course, addressing issues related to their cognition. That is, addressing issues and putting in services and interventions so that people, when they are admitted to hospital for that acute episode, they come away from the hospital healthier and having the ability to be able to reintegrate back into the community. Of course, if we can do that, we can get seniors out of the hospital sooner and healthier. We can reduce our alternate level of care days, which have been a challenge, as you know, in our healthcare system. And we can improve the value that we get out of our healthcare system and reduce things like unnecessary readmissions. Health Sciences North has rephrased the framework into 4 main categories, and those are listed here on the slide above. And that is to achieve buy-in from the hospital at the leadership level as well as at the front line, to create an environment that meets the needs of our seniors and their caregivers, to provide care that is evidence-based and based on best practices, and making sure that the care we provide is ethically sound and the research meets ethical standards. So, what has Health Science North done to become a senior-friendly institution? Well, as I said, organizational support and support at the highest level of the organization is required. And the Senior-Friendly Hospital as a priority has been identified as by the Board of Directors of Health Sciences North as a priority. And really this motion in April 2013 just reaffirms much of the work that has begun at Health Sciences North previous to this and will continue. Of course, when we think about providing care to seniors, and we think about the care that hospitals provide, and before I talk about the care and the senior-friendly initiatives the hospital has implemented, it's important to recognize that much of the care that seniors get doesn't occur in the hospital, but it occurs in the community where most of our partners, some of who are listed here above, provide that service. You know, we've had the opportunity in this slide to list some of our partners, and some of them we haven't been able to list. And for example, our community sector service providers who provide meals, who provide home support, who provide transportation, who provide assisted living are critical to the care of seniors. And I think it's important as we think about seniors' care and think about how we provide service to seniors within our community, it's together working in partnership that we'll be able to achieve the results that we need to achieve. There's one partner for which I don't have a logo and is the most important partner, and it is a partner that we heard from tonight, and that is our patients and our families. You know, when we look at, and as Richard has identified, the satisfaction with our hospital system, we could be pretty pleased. 94% of the people that come to Health Sciences North are satisfied. That's a pretty good average. And for most of us, if we were to think about, well, we achieved a 94% success rate, we might be pretty happy with that. But I'd like to think about that number in a different way. And that is that Health Sciences North has maybe 300,000, maybe a little bit more, interactions with patients on an annual basis. And a 94% success rate might seem, wow, that's great. You have 282,000 people that are happy. But let's look at it in the other way. There's 18,000 people for whom we could do a better job. And if you think of that on a system level, how many more opportunities exist around improving the healthcare system, that multiplier would be hugely significant. We heard a story tonight from Dorothy, and Dorothy is that 6%. Dorothy's that 6% that tells us where we as healthcare leaders, where we as healthcare administrators, where we as healthcare providers, organizations, and where we as a community can improve the system of care. And it is through listening to those stories we can be reflective and change practices and design a system that meets the patient's needs. I'd like to talk to you about some of the things that Health Sciences North has done to do that. Well, I'm just going to talk a little bit about the patient journey, and this is a journey around improving senior services. So to prevent admission, Health Sciences North has implemented what we call GEM nurses, our geriatric emergency management nurses. These are nurses who provide first-line support to seniors who enter into our emergency department. They provide consultation services, they provide assessment, and most importantly, they provide service coordination and trying to prevent admission to the hospital, working with case managers or care coordinators at the Northeast Community Care Access Center, with strong linkages community service providers like the Northeast Specialized Geriatrics Program. We've seen great success. Health Sciences North also, through its emergency department, has nurses, part of what we call our ED outreach team, that go into long-term care facilities. Currently, we have 5 long-term care facilities that we visit from the hospital. We will expand that in the very short term to all 7 long-term care facilities. What these nurses do is they provide assessment, they coordinate diagnostics, they help prevent admissions by providing treatments like IV therapy, and they also coordinate where it's required admission into the hospital, avoiding the emergency department, which we know for a senior can be a traumatic episode. Of course, preventing admissions, we have implemented a number of outreach, our outpatient clinics for diseases that are common to seniors, congestive heart failure clinics, chronic obstructive pulmonary disease clinics, diabetes, and we continue to look at how we can expand those services to meet the needs. Of course, there is patients that we can't prevent from being admitted. And when they are admitted to the hospital, we need to look at the care that we do provide and what are the things that we can do to improve and enhance that experience. Health Sciences North over the last 3 years implemented what was called an acute care for the elderly unit, and that unit functioned very effectively. It achieved the outcomes for seniors that we wanted it to achieve. It improved their functional status, it improved their cognitive status, it reduced their length of stay, and we did see less readmissions. And it was a very successful program. Unfortunately, the program was confined to 13 inpatient beds. So we've decided to look at how we use our resources and see, can we expand that program and make that service available and and increase the awareness around seniors' friendliness through the implementation of what we are calling our coach team. And that's consultation for older adults with compromised health. This team will be under the leadership of our new geriatrician, Dr. Janet McNeil, but working with an interprofessional team. We will also be implementing some new standard protocols that on the surface of it seem so simple for those of us in the healthcare system, but we believe will have a dramatic impact. So Janet has called this initiative the 48-5, and in its simplest form, it means that within the first 48 hours of admission, all patients will have a medication review. We will be looking at and making sure there are interventions to address their cognitive status, looking at mobility, making sure there are interventions to address mobility, their nutrition and hydration, and bowel and bladder function. As I've already mentioned, the coach team will provide individual care plans. They will communicate these care plans to the patient's physician and to the care team that is providing that service in the hospital. And they will refer, when required, to a geriatrician and make sure there's appropriate referrals at the point of discharge, which we've already heard is a complex piece when it comes to dealing with seniors with complex healthcare needs. Another program that we've had in place for the last 3 years is a program that was developed out of Yale School of Medicine, and it's called our Hospital Elder Life Program, or HELP. And the goal of that program is to help seniors maintain their cognitive and physical functioning and to reduce the risk of hospitalization. These volunteers get structured training, and they provide personal support and attention to vulnerable adults. They do things like daily orientation, and I think Dorothy talked about that. Early mobilization, and I think she talked about that. Feeding assistance and therapeutic activities. Things that on the surface seem so simple, yet have huge impacts on the outcome to patient care. Health Sciences North has listened and heard stories about the transitions in care. So in partnership with the Northeast CCAC, we have developed what we call the Transitional Care and Rapid Response Nurse Program. And the focus of this program is to identify seniors that are at highest risk for readmission and have high and complex needs. On admission, we screen and identify these patients. We've used some simple criteria: people who've admitted more than twice in the last 6 months, readmitted in 30 days, and or people who score high on frailty scales. What happens is we have nurses, who we call care transition nurses, who work with these seniors to develop tailored plans of care while they're in the hospital. And these nurses hand off in a much more gentle way than traditionally to rapid response nurses in the community care access care system that provide home visiting within 24 hours of discharge, medication reconciliation and review, and ensure service coordination is done, like making sure patients get to their family practitioner. Of course, we recognize that a number of patients don't have access to a family practitioner. So Health Sciences North has, in the last week, implemented and launched its new STAT program. We call this program the Short-Term Assessment and Treatment Unit, and it's for frail seniors over the age of 65 who have no access to primary care provider. Now, I just want to make sure that people understand. That doesn't mean people that do have a primary care provider are excluded, but there is a different mechanism for access. But the point of this program is we want to make sure those people that we are discharging with complex needs, who we know don't have access to a primary care provider, have the opportunity to successfully reintegrate back into the community. This team is an interprofessional team. It provides a comprehensive range of services, and it's really designed to prevent decline in health, hospital readmission, and one of the greatest fears of seniors, institutionalization into a long-term care facility. Health Science North uses research and participates in research to drive change in practice. Early in 2011 and later in 2012, 2 provincial reports were released by 2 different organizations. I've just summarized them here as the Provincial Senior Friendly Hospital Reports. But they identified 2 priorities in the care of seniors, and that's delirium and functional decline. Health Sciences North, participating with about 40 other hospitals in the province of Ontario, is evaluating how we can measure on an ongoing and daily basis patients' risk for delirium and functional decline. This research is being led by Sunnybrook Health Sciences Centre. But what we've noticed as we've implemented the tools to assess on our pilot units people that are at risk for functional decline and delirium, a change in practice. And this is one way we're seeing research, as research is being rolled out at our institution, how it's changing practice for the benefit of seniors. We heard about the need to get patients out of bed. Health Sciences North, again, participating in research through the Council of Academic Hospitals, has implemented a program called the Mobilization of Vulnerable Elders in Ontario. We call it Move On. Again, we are taking the practices and seeing how we can integrate them into our 48-5 initiatives. Health Science North not only participates in the development of knowledge and changing practice, we're also leading in terms of the development of new knowledge. Under the leadership of Dr. McElhaney, one of the research initiatives that she is undertaking is the 48-5 initiative to study over a 2-year period to see how effective that initiative is in improving seniors. Again, in improving seniors' ability in terms of function and cognitive status. Janet, of course, holds the Health Sciences Volunteer Association Chair in Geriatric Research through Health Sciences North and Amherst. Health Sciences North is also leading research in evaluating the degree to which we can improve the transitions from the hospital to their home by researching and evaluating the Care Transition and Rapid Response Initiative. We evaluate the ability to reduce the readmissions for seniors with high to very high frailty needs and conditions such as diabetes, congestive heart failure, COPD, and dementia. I hope that gives you a bit of an overview of some of the things we've initiated on our journey to improve our care to seniors that are hospitalized. And yes, there is a long journey for us to continue to go on. So thank you very much.